We all have fear of the unknown, and I think when we're talking about that vaccine, that's what's at the root of all of the concerns is, yes, it's new, and as I mentioned earlier, I do feel like it's safe, even though it's been developed quickly, but we don't have years and years of experience with this vaccine in the same way we do with, say, a flu shot, which we all get every year. So on the one hand, I have this unknown entity. What if there's something out there that when we give this vaccine to 100 million people, what if there's a problem that we haven't recognized yet? The Pfizer trial, to take one, was powered to find adverse effects that happen in 1 in 1,000 patients with about 83% accuracy. So that's pretty rare. Of course, when you expand that to 100 million people, that could still be potentially a lot of people, but there's that out there. There's that very, very small chance that something could happen that we haven't seen yet. On the other hand, I have a known entity in COVID-19. And I think we've all seen firsthand what COVID-19 can do. We've seen our hospital pushed to the brink with patients, with its effect on our staff. We've seen this pandemic take over 300,000 lives in the past 12 months in our country alone. And so if I take the potential, the very small chance that I could have an adverse effect to this vaccine versus the very real entity of COVID-19, it was an easy decision for me. And even though there's that little bit of fear about whether I should get a vaccine or not, I know in the long term that I can protect myself, that I can protect my family, and that collectively we can do something to end this pandemic.